Hello everyone, and welcome back to our DPT Clinical Survival Guide series, where we're diving into outpatient physical therapy. Just as we did in the last installment of this series, I'm going to tell you guys from my personal experience some of the best advice and just a general overview of the outpatient setting and physical therapy as I can. Now, I want you to keep in mind that this is from my personal experience, and sadly, I have not been immersed into a specialty population. I have only been in orthopedics for the outpatient setting, so keep that in mind, but I have at least had a couple days within a decent amount of the specialties, so I'll try to give you the best overview possible. So just to give you a quick overview of exactly what we're going to cover today, I'm going to put it on screen right now. We're going to start off with talking about our role within the outpatient setting, who you might be working with as in other professions, how to prepare for each day, some of the questions you should probably be asking within your subjective interview, how to prepare for the experience as a whole, and some ways to impress your CI early on. There will also be timestamps in the description that you can jump to any of the parts that you want to see in particular if the whole video doesn't interest you. With the introduction out of the way, let's get into our first section, the role of physical therapy within the outpatient setting. Now, I've tried to minimize this as much as possible so that you can keep it simple and just in the back of your head. The first thing that's kind of our role is to screen for red flags in these patients. We also want to help them return to their prior level of function, if not more. You might also be doing some return to sport with some of the individuals you see in this setting, as well as you're just trying to optimize their quality of life as much as you possibly can. Now, the list of professions that you may work with is quite extensive, so let's jump into it right now. The first of which is going to be physical therapy assistants. These are the people who are going to help you treat appropriate patients for return visits and help you with exercise progression. You'll also run into some physical therapy aides. These are the people who will help you with patient transport, cleaning, clinic maintenance, and a lot more. You're also going to be with occupational therapists. They mainly work with hands a lot of the times as hand specialists, the upper extremity, ADLs, so activities of daily living, and work-related duties, and depending on the setting and the institution you're in, they may work on cognition as well. You may also run into and work with speech-language pathologists for swallowing and speech difficulties, and they are also someone who may work with patients on cognition. You may also run into massage therapists for example, additional manual therapy, also acupuncturists for help with pain management. You might run into orthotists or prosthetists for patients who are amputees or have neurological conditions. You'll also be working with receptionists for scheduling and insurance. You may also be working with podiatrists who specialize in foot and ankle pathologies, as well as medical doctors, physician assistants, or nurse practitioners, most of the time remotely just for referrals to and from physical therapy. Next, let's get into how to prepare for each day. The first thing you're going to want to do when you hop into this setting is you're going to want to review the schedule. This will help you be familiar with all of the diagnoses of the patients you'll encounter during the day, as well as it can help you kind of sift out and figure which patients you feel most comfortable with so that you can communicate that to your clinical instructor and help things move smoother. Something you may also want to do is reserve some private treatment rooms or specific spaces within the clinic, if those are available, for patients with specific conditions, such as ones where you want to minimize distractions, or maybe even just for an initial evaluation where you want it to be quiet. Another great example of this is if you have a video translator and you know that the gym is very busy and loud and you want to make sure that you can hear a patient who needs a translator, then you might want to try and reserve a private room or a private space for them. Now, you're also going to want to do a good chart review on each of your patients. Now, this may look a little bit different depending on if it's an initial evaluation or a return patient, but for the most part, it should match pretty well. For an initial evaluation, you're going to want to look at the referral note from the medical doctor physician assistant, nurse practitioner, or whatever it ends up being, as well as if there's a previous note from physical therapy that can give you some insight into it, that would be great. Also, one of the things that my clinical instructors in this setting wanted to look at is see if they had any emergency department visits recently, because that can give you an idea of if they had a spike up in their pain or anything like that recently and can provide more context. In addition, you want to see if they need any interpretation services, especially for that initial evaluation, so that things can go smoothly. For return visits, it's going to be very similar. Looking at the referral note, if you need a recap or even the initial eval or re-eval, if you have one on hand. Looking at most recent PT note, whether it was from you or from another provider who is working with this patient, just to make sure you're up to speed on them, as well as making sure you know if they have the need for interpretation, so that way you can be fully prepared. Overall, the main things that I like to look for in my chart review within the outpatient setting are the referring condition, the method of injury if there was one, any precautions that the patient might have, what tests or measures have been done, whether that's special tests or outcome measures that can help you track things over time. You want to know some of their comorbidities as well as medications they may be on. Now, when we're thinking about the subjective interview, there are a couple of things that you want to keep in mind. The first of which is you want to figure out the chief complaint if it wasn't clear from the referring note, the method of injury, again, if it wasn't found within the chart review, what they do for work or what they do when they're active or doing whatever they enjoy. For example, some hobbies might be a good example of something to ask them about, who they care for, whether it's kids, pets, parents, or anything else. Again, medications if it wasn't clear, what helps it get better, as well as what helps it get worse. And then you want to know their patient goals as a whole, because you want to have their buy-in and know that you're listening to what they want to get out of this, as well as ask any additional questions that are pertinent to the patient and their condition, so that you can have a full picture of the patient. Now, in the outpatient population, where there is a lot more independence and most of your patients are community dwelling, you want to think about a lot of things when you're preparing for an experience in this. The first of which is you want to know the supervision guidelines for each of the individuals that may be working under your supervision. For example, this could be physical therapy assistants, this could be physical therapy aides, or this could be other professions such as massage therapy, acupuncturists, and more. On top of this, you want to be really comfortable with your exercise prescription as a whole. This includes dosing for whether it's balance or power or strength or flexibility. You want to be able to have that off the top of your head to really help you prescribe what's best for that patient, as well as have a good idea of what progressions or regressions you could use with some of the major muscles and body systems. That way you are prepared for whatever comes your way. Another important aspect of outpatient physical therapy is knowing tissue healing timelines, as well as just knowing your basic interview, examination, and evaluation items and being really efficient with them, because especially in the outpatient setting, you're a lot more limited on time. So you want to be sure you're very good with your manual muscle testing, your myotomes, your neuroscreen, sensation, everything like that, so that you can just rep it out whenever you need. The last two things that I think are important to review are going to be your special tests, which you're going to have to know your specific patient population, because that will kind of change what special tests you might want to focus on in your preparation. But also you want to prepare yourself with knowing some good outcome measures for the populations you're working with. Two that I know I use consistently throughout my outpatient rotations that I loved because you can apply them to any rotation at all, whatever specialty it is, are the numeric pain rating scale, so the NPRS, as well as the patient-specific functional scale. Those two are definitely ones that you can rely on consistently, and they will get you good information that you can utilize to help tailor your treatment moving forward. Now, some easy ways that you can really impress your CI off the bat in outpatient physical therapy is really if, one, like I said earlier, you go ahead and with your own initiative, go and reserve the rooms for the patients that need them ahead of time, because then they can see that you're really showing that drive to be prepared for the day and you know the schedule. Also, another great thing to do is to clean up your workstation, or if your clinical instructor was working with the patient instead, cleaning up their workstation right after to really help with the physical therapy aides at the clinic, because in the outpatient setting, things are a lot faster, and whatever help that everyone can get will really go a long way. Lastly, another thing that you can do is be really solid and efficient on those basic interview, examination, and evaluation skills. I cannot emphasize this enough. As I've already said in one of my other videos, 5 simple ways to take yourself from a student PT to a seasoned one, really just being efficient at the easy things shows that you are very competent and builds that trust both with the patient as well as with your clinical instructor early on. So make sure that you really emphasize that in your preparation for this experience. Well, I hope this provided you with a simple and concise guide to what you can expect from an experience in outpatient physical therapy, giving you some tools to help you prepare, as well as knowing who you might encounter throughout this experience. If you enjoyed this video, make sure to hit that like button and subscribe down below, as well as check out my other videos for clinical survival guides, especially because I'll have more and more coming out within the next few weeks, in addition to some other content such as day in the life content starting up in a few weeks again, as well as some fun things like stereotype videos and MPTE prep that's on the horizon. Also, if you are interested in trying out Picmonic and you want to continue on with it, make sure to check out my 20% off discount code in the description of this video down below. Thank you all so much for watching. This has been KBDPT, and I'll see you all in the next video.